My name is Jason Kotar. I'm the host of Knowledgeable Aging. Joining us today to talk about medical marijuana and CBD, a physician's guide for patients, is Dr. Matthew Mintz. Dr. Mintz is a fellow in the American College of Physicians and is currently a solo practitioner in Bethesda, Maryland. In addition to concierge services he offers to his patients, he is one of the few physicians who certifies patients in both the state of Maryland and District of Columbia for medical cannabis as part of his regular practice. Dr. Mintz is an expert in CBD and medical cannabis and is the author of the book, Medical Marijuana and CBD, A Physician's Guide for Patients. How are you doing today, Dr. Mintz?
I'm doing good. Sorry for the technical difficulties. I don't know exactly what happened, but I think we're good. We're good to go now, I think.
Yeah, it happens. No big deal. So for those joining us today, if you have any questions, I encourage you to type those questions in. Time permitting, we will do everything in our power to get those questions answered. So Dr. Mintz, I'm going to turn it over to you.
Yeah, so I want to thank everyone for coming. My name is Matthew Mintz. I'm an internal medicine primary care physician. I practice here in Bethesda, Maryland, and it's good to see everyone today. Most of what I do is internal medicine primary care. I have what's called a membership, or some people call it concierge practice. Small practice. We see people same day appointments, next day appointments. 24/7 phone access. And so I was at George Washington University for 20 years. And then 3.5 years ago, moved out close to my home in Rockville, and my practice is in Bethesda. It's right across from, it's in the Wildwood Medical Building. And so I not really intended on getting involved in medical cannabis, but if you can imagine starting a new practice, things can be relatively slow. And a few months after I opened my practice in Bethesda, a cannabis dispensary opened up in my building. And I wasn't very busy at the time because my practice was still very, very new. So I was curious as well. And so one of the things they told me is that there were very few physicians at the time sort of registered to certify patients for medical cannabis. And so since I wasn't that busy, I said, sure, I could try that. And I'll be honest, I was a little bit skeptical at first. I was worried that patients would be coming to get sort of a legal excuse to use marijuana. But I found that to be not the case very, very quickly. The first patients I saw were just very, very sick. Stage 4 cancer with metastases and horrible pain or side effects from their chemotherapy. Patients on chronic pain, had surgeries on opioids, couldn't get off, just very sick people. And I soon learned how well the cannabis really helped these patients. And so I decided that, look, this is something that I want to continue doing, and if I'm going to do it, I have to learn all I can about it. Unfortunately, because of some of the federal regulations, there's not a ton of research. I'll show you some studies in a bit. And because of that, there's not a lot of opportunities for education for both patients and physicians. And so I spent some time taking courses, doing my own research, and then experience with my own patients and what worked for them and what didn't. And really have gotten to know this field very well. Because there is so little out there, I actually decided to write a book. It was recently published. It's called Medical Marijuana and CBD, A Physician's Guide for Patients. And so I'll share a little bit of those, little of the highlights from the book today. But hopefully we'll have some time at the end. I know we're starting late to answer any questions from the audience or from you. But basically, in a nutshell, the idea of using plants as a medicine is not old at all. We've been doing this for centuries. Some of the common medicines that we take today, some medicines for high blood pressure, are based on cannabis regimens. In fact, even newer medicines like Taxol, which is a cancer chemotherapy agent used predominantly in breast cancer, is made from the bark of a yew tree. And in fact, the opioid medications, the medicines we use for chronic pain, very similar model to cannabis. So they come from the poppy seed plant. Unfortunately, they're used for recreational drug use, but that same medicine can be, same agent or ingredient can be used for medicines that we use today. And cannabis is like that. So I wanted to go briefly about sort of, how cannabis works, the history of cannabis, how cannabis works, some of the conditions, and then talk about and sort of answer questions about how to get cannabis, what you can do, any of the questions that you have. So again, to begin with the history, so again, we've been using this for centuries, the first reports, written reports, were in the 1800s in India. There's there's mention in Chinese texts, in ancient Greece, ancient Rome, and it actually was in the early 1900s was actually used as a regular medicine. You could find it in tonics and things like that, and tax laws actually changed that, and so use of that dropped down precipitously until about the 60s, when people were sort of experimenting with drugs, and there were some anecdotal reports about use of medical cannabis for medicinal purposes. And then in the 70s, we had the Controlled Substances Act, which scheduled cannabis as a Schedule I drug, meaning it had no medicinal purposes and was very addictive, both of which are the opposite. But yet that scheduling maintains today. So it is federally illegal, which makes it very challenging to use in research and things like that. However, with the AIDS epidemic back in the late 80s and early 90s, a lot of the patients were seeking treatments. And so that was the first way that medical marijuana was legalized in California. And up until recently, it was available in 33 states in the District of Columbia medicinally. I believe the current election results, there's a few more states that just recently legalized cannabis. Cannabis is now legal in the state of Virginia, close to our area. And one dispensary finally just opened a few months ago. So more and more states have legalized medical cannabis, to the fact the majority of states have it legal. So it's becoming more commonplace. First, I want to talk about sort of how cannabis works. And the way it works has to do with something called the endocannabinoid system. So we have lots of systems in our body. We have the nervous system. We have the respiratory system, which helps us breathe, the cardiovascular system. The endocannabinoid system is another system that our body has, and it helps do something called homeostasis. Homeostasis is a fancy word for balance, and it helps keep our body in check. Our body likes to be stable and be the same. We don't like our temperatures to go up and down. We like to, so it controls things like temperature, it controls stress, sleep, memory, immunity, appetite. All these things are part of the endocannabinoid system. And so basically there are two components. There are agents and there are receptors. And so there are two what are called cannabinoids, molecules that we make in our body that are produced by the brain, and they hit two receptors, the CB1 receptors, which are primarily in the brain and nervous tissue, and there are CB2 receptors, cannabinoid receptors, in the organs and bone. And so these cannabinoids, these endogenous or homemade endocannabinoids made by the brain, hit these receptors and regulate all those functions. And this system's been around for 600 million years. The cannabis plant itself has only been around for 25 million years. So this is a natural system that we have, and it just so happens that a plant-based product stimulates that system. And so marijuana basically, so we have our cannabinoids that we make in our own body, but there are plant-based products that also hit those same receptors. So those are phyto or plant-based cannabinoids, and marijuana is one of them. And there's many cannabinoids in the marijuana plant. The two main ones are THC and CBD. THC is the thing that makes you high or makes you sleepy. It's also very good for anxiety, very good for appetite, very good for sleep. CBD does not make you high or sleepy, but can also be good for anxiety. It's very good for inflammation. It actually is an appetite suppressant. So what's interesting is some of the factors of both THC and CBD are similar. Some of them are opposite. So it's interesting how they work together. Now, one of the questions I get a lot, because CBD is all over the place, is what's the difference between CBD and medical marijuana? So marijuana has both CBD and THC. They're cannabinoids. There's other cannabinoids in the plant. Again, it's legal medically in 33 and now more states than DC. It's also legal recreationally in a few states. And you can get lots of different versions of THC and CBD, and we'll talk about the different agents. CBD alone has medicinal properties, though. Usually, if a teeny bit of THC is there, it helps it work better, but you can use CBD alone. And there's another plant called hemp, and hemp is very similar to the marijuana plant, except it has almost no THC. And because it has almost no THC, it is legal everywhere in the United States. Because it's legal and everywhere in the United States, hemp-based CBD is a lot easier to get and a lot less expensive than marijuana-based CBD. So they're both basically the same, but one is a lot cheaper and a lot easier to get. Now, the problem with hemp-based CBD is not regulated by the FDA. So you have to be really, really careful about what you get. No one's really checking, on the purity and making sure that the CBD that you get is good. The companies have to do it on their own without any obligation to do so. So you can buy this stuff now online. You can buy it in the gas station. You can buy it at Bed Bath & Beyond now sells it. But a lot of these products that you see in some of these places are not quite good because, again, no one's really regulating it. You can't find good high-quality CBD in CVS or GNC because it's not yet regulated by the FDA, and so the bigger boxes don't want to sell it. So most of the good stuff is online. There's a lot of things that you have to look for good high-quality CBD. The most important thing is that it's verified by a third party. I use in my office CBD Distillery, but there are a couple of other good products. So in addition to the cannabinoids, THC, CBD, there's also terpenes. Terpenes are the components that give cannabis its flavor, its smell. It also has some biologic properties as well. So one terpene that's common is humulene. Humulene has sort of a woody, earthy smell, but it's also got anti-inflammatory components, antibacterial components. At the top here, you can see some of the strains that have humulene as one of its terpenes: Girl Scout cookie, White Widow, etc. So often we'll use specific strains for specific diseases. And then finally, in addition to all the cannabinoids, THC, CBD, and others, all these terpenes and other flavonoids and components, it's also how they all work together. This is called the entourage effect. So it's not just the one molecule that hits the one receptor. It's how that combination in the various different strains of plants work to get a reaction. So certain strains are good for anxiety, certain strains are good for pain, certain strains are good for sleep, certain strains are good for depression. So you have to know the right strain. There's lots of ways to divide it up. The two most common ways, though, are some strains are what are called sativa strains. So just even if they have a high amount of THC, they can be alerting and increased energy, whereas indica strains, again, based on their terpenes and different profiles, are good for relaxing and more for sleep. The other thing is how you use cannabis. You can certainly take the plant and roll it up and smoke it. And I don't ever recommend that people smoke it, but you can use that plant in different ways in different formulas. So it comes in pills, it comes in liquids or tinctures that you drop under the tongue, it comes in creams that you can rub on the skin, or the other thing that you can do if you want to inhale cannabis without smoking is you can vape it. So vaping is taking the leaves, extracting the oil, putting that oil into a little cartridge, and then you can inhale the oil vapors, and that's a safe way of inhaling it without smoking it. Lastly, a couple of the uses of marijuana, and there are many of them. One thing to talk about has to do with lethality and additivity. So again, any medicine we use has side effects, has risk. And one of the concerns about marijuana is it being addictive. In fact, if you look at this chart, you can see that there's a very low risk of addiction with marijuana. It's no different than, let's say, caffeine. On the other hand, if you look at medicines that can kill you, marijuana also low on the spectrum. Something like alcohol also is a moderate lethality, and so we don't usually think about alcohol as killing people because typically if you drink too much, you'll throw up or you'll pass out. But you hear about these college students, for example, who drink way too much too quickly, and you can die from alcohol toxicity. Can't die from marijuana. No one's ever died from marijuana. So so it's very low addictive risk. It can't kill you, and so there's a safety factor as well. So one of the common ways I use marijuana is for the treatment of pain. In states that have legalized medical cannabis, doctors are writing almost 2,000 fewer pain prescriptions per doctor per year in states that have gone from have legalized medical marijuana. And there's also, if you look at states where they've legalized marijuana, the deaths from opioid overdoses have decreased. So it's being used to treat pain. This is one study that showed that you can actually decrease opioid use by 64% in patients who use medical cannabis with opioids. So not always am I able to get patients off opioids, but I can usually lower their dose. It's a really good treatment for chronic pain. Also very good for anxiety. In high doses, THC can actually make you anxious and give psychotic symptoms. But at very low doses, it seems to be calming. CBD, as I also mentioned, can be calming as well. Here's one study in veterans with PTSD, and they had a 75% reduction in their anxiety scores from using medical cannabis. Cannabis and cancer is also very interesting. There's 4 ways in which you can use medical cannabis in cancer. You can use it to treat the symptoms of cancer. As I mentioned, some of the first patients I saw had metastatic cancer into their bones, and it was very painful. It can also help reduce side effects from cancer chemotherapy, nausea being one of them. But also there's some anti-cancer properties of cannabis, and so it can be helpful in treating cancer or maybe even preventing cancer. So very, very interesting stuff. Again, we need more research on this, and hopefully the federal laws will change to allow for this. And then finally, in seniors, I find it of value. If you look at things that seniors have, anxiety, insomnia, agitation, cannabis is good for all of them. And there's little risk of addiction. There's little risk of side effects or interactions with other medications. And so instead of having this pill for anxiety and this pill for insomnia and this pill for agitation, you can take one plant-based medicine that won't interact with your other medicines and reduce the number of pills seniors can take. So I think it's a really good option for seniors. So how do I get this? So every state is slightly different, but there are similar processes. You have to both register with the state and you have to register with a certifying provider. In DC, you have to see the provider first. In Maryland, it doesn't really matter, but you need both to get medical cannabis. In Maryland, the registration with the state is all online. Then you go find a doctor that will certify you, and then you have the paperwork that will allow you to go to the dispensary to get product. Now, most of the certifying providers are in these clinics like Advanced Green Doc and Green Health Docs, where they just go over the paperwork. They will not generally tell you what to take, how to take it, what to use. That's how I differ a little bit in my practice. I'll actually sit down, go over a thorough history, ask about your medicines, what your symptoms. I give all my patients sort of a customized regimen about what to use and what to get. But where you get this is at the dispensary. That's the only place that you can go. It's not a prescription. You can't go to CVS. You go to a cannabis dispensary to get all these various products on how to do it. So again, as I said, I've spent a lot of time sort of researching and learning about this. I've put the information in a book called Medical Marijuana and CBD, a Physician's Guide for Patients. It's available on Amazon currently. So that is a very, very quick sort of overview of medical marijuana and CBD, and I'd be happy to take any questions.
Yeah, good stuff, Dr. Mintz. Quite a few questions, as you can imagine, a lot to unpack. You talked about the process is different in state and of course here in the District of Columbia. So if somebody is interested in registering and getting certified, approximately how long is that process if they don't have a physician?
Well, so there's, again, each process is different. So
Okay.
There's the registration process, which is normally a couple weeks. Again, that's sort of essentially the state that you're registering under DC. It's sort of verifying that you are a resident of that state, that, it requires identification, proof of address, that sort of thing. The process for getting certified by the provider, it sort of depends on the provider that you have and how quickly to get in. Not most of the doctors are not registered to certify patients. So if you're lucky, and your doctor is registered to certify, you could go to your doctor and have them do it, and however long it takes you to get into the appointment with your doctor. But again, most doctors are not registered to certify. So you either go to someone like me who does this as part of my medical practice or one of these other clinics. And yeah, the getting into the appointment for that is actually not too hard. So usually the rate limiting step is registering with the state.
Gotcha. Can I drive and use medical cannabis?
Good question. So from a legal standpoint, no, it's never legal to drive with medical cannabis. That said, it's not like alcohol where the cops can pull you over and do a cannabis breath test. The only really way to test for cannabis is in the urine or blood, and the cops aren't doing that, as they pull you over. So there's no way they can know that you have medical cannabis. And so they would only pull you over if they suspect that you're under the influence. So if you're weaving in and out of traffic, and then they find cannabis in your possession, even if you have a medical certification, that could put you in a lot of trouble. So while technically it's illegal, the reality is it has to do with impairment. So there's a lot. So for example, patients take Benadryl and Allegra that makes them sleepy. And technically it's not illegal to drive with that, but many patients on those medicines shouldn't drive. with those or other prescriptions medicines they take. Opioid medicines, okay, you can, again, these are chronic pain medicines. Again, it's not illegal to drive with them, but many patients who are taking them, if they're taking too high of a dose, shouldn't be driving with that. So how do you know? And the answer is it depends on whether you're impaired or not. Unlike alcohol, most people who use cannabis can sort of tell when they're high or sleepy. Their judgment is not impaired, their just reflexes are. So it is not, though technically illegal, if you use very low doses that are not impairing, you should be able to drive. It's like, if you take a sip of wine, you're not supposed to drink and drive, but if you take a sip of wine, is it safe to drive? Probably yes. If you take a half a glass of wine, is it safe to drive? The answer is it depends on who you are. If you're my mom, who's older and petite, she half a glass of wine, she's done for the night. Someone like myself, if I have a half a glass of wine, I'm probably okay to drive. So everyone's a little bit different, but it's about impairment. It's about, are you taking enough cannabis to sort of, impair your judgment or reflexes?
What if I'm taking several different medications for whatever reason? How does medical cannabis interact with that?
So the good news is there's very few interactions, so it should not interact with too many things. The way our body metabolizes medications, gets rid of the medications in our body, is through a series of enzymes. And so cannabis, some of the components increase those enzymes or decrease those enzymes. So depending on what you're taking, the other drugs that you have could take longer to get out of your system, which would mean that you have potential increased side effects, or shorter to get out of your system, meaning that that might not work. So there's some potential interactions, but for the most part, those are all theoretical. And in studies, at least that they've done in Europe, there doesn't seem to be any major significant interactions. The only real medications that are interactions, some of the medications that always interact with other things, typically antivirals that they use for HIV, certain antifungals, a couple of the antidepressants maybe, and then blood thinners you always have to be careful of because that level. But for the most part, many drugs do not interact. Obviously, you want to ask your doctor about that if you're using either recreationally or medicinally. But one of the nice things about medical cannabis is that while there are some interactions, there are very few, and usually you don't need any adjustment in your medicine dose.
I want to stay with that, doctor, as far as any adjustment in the dosage. So let's just say you're working with a patient for the first time. Would you see them on a little bit more frequent basis in order to kind of determine the level of medical cannabis that's needed for them?
Right. So that's a really good question. So the answer is I do that and I enjoy doing that. The issue really is most of the patients I see for medical cannabis have a regular doctor, and so so they're usually seeing me the one time for the consultation, and so I will give them some instructions about what to do. And they can always email me or call me if they have questions. I'm always happy to see them back to see how's it going and how we can adjust the dose. They'll have to charge them an extra visit appointment for that since they're coming for a visit. So sometimes that can be an issue for patients. But yes, I absolutely do that. But most of these other certifying places that you go to, that's all they do. They certify you. They don't give you any recommendations or adjustment in dosing. That they just sort of certify you. And so they tell you to go to the dispensary, and the folks at the dispensary can help with that. And some of the people at the dispensary are quite good. They're very, very knowledgeable. The problem is, number one, well, there's a couple problems. One, there's no certification. So, I mean, anyone can be there's no qualifications. You don't need a graduate degree or anything like that. Two, you don't know who you're going to get. You don't know if you're going to get someone who's been doing this, in California or Colorado for 10 years and came to Maryland or DC to start this, or they just, they're brand new to cannabis. And so you don't know sort of the quality of the person that you're going to get. And then finally, they're not clinicians. They don't work with patients. They're not, knowledgeable about other medications and things like that. So you really do have to be careful.
Yeah. You had mentioned the different choices they have, and I don't remember the terminology, Doc, but you've got the daytime and the nighttime. So let's just say somebody's doing this on their own and they haven't reached out to you. Which one should they choose? Is it kind of just almost like trying to determine how much you should take? Is it almost kind of just you're self-medicating?
That's a good question. In a way, yes, because one of the problems is while there is some limited research, there's almost no strain-specific research. So in other words, so the different there's hundreds of different kind of strains with different amounts of CBD and THC and terpenes and have different ways. And so unfortunately, because we don't have the research, a lot of that information is sort of anecdotal. And so the folks at the dispensary can often tell you, well, if you have arthritis, this is a good one, or if you have anxiety, this is a good strain. A lot of that can be found online, but one of the things that I found when I was doing my research is that if you Google like what's the best strain for anxiety, you'll find 10 different websites with the top 5 strains for anxiety, and they're all different. Yeah. So in my book, for example, I have a chapter for each disease, like anxiety, and I'll list basically what I think are some of the strains to consider if you have anxiety. So that's one thing. A lot of it's anecdotal, but you can look at either resources or ask people, and then it's how do you use it? Are you vaping it? Are you using an edible? And what's the dose? And all of that sort of depends on what your needs are. And then the general mantra I go by is to start low and go slow. So you start with very, very low doses, which initially so low it might not affect you, and then slowly go up. And by doing it that way, you can get the benefits of cannabis without any side effects.
What about those folks with cognitive impairments or cognitive declines like Alzheimer's or dementia?
Yeah, that's a common question that I get. So there is some preliminary data, mostly in animals and in tissues, where there might be some, neuro benefits to the cannabinoids. They have neuroprotective effects, meaning they preserve the cells, may improve function, but it's all sort of theoretical. There's no human data on sort of helping with those things. However, there is very good data on the treatment of the side effects. So for example, patients with Alzheimer's often get agitation. They get, their behavior changes, they get very, very agitated. Mm-hmm. And so cannabis can be really good at calming patients down, decreasing that agitation. Some of the prescription drugs that are currently used for agitation in people with Alzheimer's are these atypical antipsychotics, which number one have a lot of serious side effects, and two really essentially just sort of put the patient to sleep. They really sort of just snow them, and that's not really the best thing to do. So cannabis is interesting, and it can help with agitation without completely snowing the patient, without some of the dangerous side effects of the prescription drug. So definitely can be used to treat the symptoms of dementia, Alzheimer's. You may at the same time be helping a little bit, which again, we need the research, but you may help a little bit with the process. But this is why I think it's a good option for those patients.
All right. What about insurance? Does insurance cover this?
Yeah, so that's a problem. So insurance doesn't cover any of this. Certainly it does not cover the medication at all. So when you go to the dispensaries, you're paying out of pocket. Not only that, because it is still federally illegal, there's issues with the banks and stuff. So even though this has been going on in Colorado for over a decade, none of the dispensaries take credit card. It's an all cash transaction. And so every dispensary, at least in our area, has an ATM machine because most people don't carry a lot of cash with them. And so it's an all cash transaction. With the certification, going to see the provider, again, if you see your regular doctor and your regular doctor is able to certify you and your regular doctor takes insurance, that part could be covered by insurance. But as I mentioned, most doctors don't really do that. The clinics, these cannabis clinics that certify patients, they're an all-cash business. They don't take insurance. For me, I don't take insurance either, but because I'm a regular doctor, I actually give patients an invoice that they can submit to their insurance. And as long as they don't have an HMO or Medicare, if they have an out-of-network provider, essentially that's what I am. I'm an out-of-network doctor. They can submit the paperwork that I give them to insurance, and many of them get some, if not the full amount, back. So that's one way in which I try to help patients with the cost issue by giving them an invoice they can submit to their insurance.
Okay. Last question. Somebody chimed in and said, once recreational cannabis is legalized in a state, what happens to the entire medical marijuana business for doctors?
That's a good question. Let's talk about for patients too. So,
okay.
Well, let's talk about the difference between medical cannabis and recreational cannabis. So there's the legal aspect of it. And again, if recreational cannabis becomes legal, then that's no longer a factor. But there's some other things too. And the main thing is sort of quality control. What's really good about medical marijuana, despite, besides the legal aspect, is that it's highly regulated. You know exactly what you're getting. and how you get it. So for example, recreational cannabis is legal in DC, and they have some, and you know, you can get cannabis in DC recreationally, legally, but you don't know what you're going to get, and you don't know where it's coming from. It's, you know, grown in Jack's backyard, and he says it's this certain strain, but you don't necessarily know, and the supply is not very consistent. With medical marijuana, it's highly regulated by the state. And so that at least, and you can use it, and more often medical cannabis as opposed to recreational cannabis comes in all these different formulations so that you don't have to smoke it. You can use the edibles, you can use the vapes. So there's more alternatives, it's more consistent, it's a safer thing to use. If recreational cannabis becomes legal, like in the state of Maryland, or changes, because right now, even though it's recreationally legal in DC, it's sort of hard to get, you will have other options. But again, it's you know, getting medicine from a pharmacy as opposed to sort of making your own medicine. There's a dose consistency and a safety issue. The other thing is going to be, I think, cost. I think if you certify as a medical patient, and again, this is just, you know, like in Colorado and California where this is happening now, the cost of the products may be actually lower, because I think there's some tax breaks and things like that. So it may be worth the certification to be a medical patient, because you may be able to get the products at a slightly lower cost. So it'll be interesting to see. I do predict that DC will have more recreational cannabis consistent with Colorado and California, as opposed to sort of the shady way they do it now. And I wouldn't be surprised if the medical cannabis, recreational cannabis becomes legal in Maryland in a few years, and you start seeing recreational dispensaries pop up. So we'll see.
Very good. Well, Dr. Mintz, how can people find you?
Very easy. You can go to, so I have two websites. I have my regular practice website, which is drmintz.com. I also have my cannabis website, which is mdcannabisdoc.com, or you just Google me. You should be able to find me either way. And for patients who are interested, they can schedule an appointment online, book online. We can certify patients. Again, the link to my book is also on the cannabis website if people are interested in finding out more.
Very good. So as far as knowledgeable aging, this webinar, along with, we try to do 2 to 3 webinars per week. You can find us on our YouTube page. Go on to YouTube, type in knowledgeable aging. We encourage you to subscribe. We're updating it typically 5 to 6 times a week. This webinar, just like many others, will be converted to a podcast. So you can go on to Spotify, Apple Tunes, etc., and find us there. I'm your host, Jason Kotar, and this is Knowledgeable Aging.